And once again, we have Dr. Martha Buchanan, who is our lead medical consultant for DHEC, and she's going to tell us a little bit about respiratory illnesses affecting our state and where we currently stand. We appreciate you all sharing her comments and recommendations. And after her comments, we will open it up for a brief question and answer session. But for now, I'll turn it over to Dr. Buchanan.
Thank you, Casey. Good morning, everybody. If you've looked at the numbers, you know that we are trending down a little bit in our numbers and have been for a couple of weeks now. Although if you look at previous flu and respiratory disease data, you know that we have peaks and valleys. So we have to kind of continue to watch and wait and see if do our numbers go back up or do they stay trending down, which would be fabulous. But we're not sure yet what's going to happen. You know, and we also still had over 300 hospitalizations in the past week and 11 flu deaths. So flu and COVID are still with us, even though things are kind of slowing down right now. And we continue to see outbreaks in schools and long-term care. I want to talk a little bit about vaccine coverage. As we've said previously, vaccination is your best bet for protecting yourselves and those around you, in addition to some other behaviors you can put in place. As of Saturday, only 6.58% of our eligible residents in South Carolina had their up-to-date 2023-24 COVID-19 vaccines. We'd really love to see those numbers get higher. Flu vaccination rates are a little bit better, but we could also do better with flu vaccination rates. And so I think the important things to think about when we think about vaccine is really that both of these vaccinations are very safe, they're very effective, and they are one of our best tools in reducing illness in our community. And so really encourage everyone to get them. It's not too late to get vaccinated. As long as we still have COVID and flu circulating in the community, vaccination is an appropriate step to take. And they're readily available at health departments, Walgreens, and other pharmacies across the state. So if you haven't gotten your vaccine yet, we strongly encourage you to do so. Even though the numbers are kind of trending down and maybe you're thinking, well, there's tons of flu already, I don't need to get a vaccine. It's the best protection, in addition to some other things I'm going to talk about. So people might also say, so the numbers are trending down. Do I still need to wash my hands regularly, stay home if I'm sick, cover my cough? Consider masking if you're a high-risk person who is going into a crowd. And the short answer to that is yes. Washing your hands, staying home if you're sick, and covering your cough are things that need to be done year-round, not just during respiratory season. Hand washing alone helps reduce illness rates greatly. So we really encourage everybody to keep those things in place year-round, not just during respiratory season. So those are kind of our main points. Get vaccinated, cover your cough, and stay home if you're sick. Flu and COVID are still here and still present in our communities and still making people sick and causing hospitalizations and even people to pass away. So with that, I'll open it up for questions.
Thank you, Dr. Buchanan. And folks, if you'll raise your virtual hand, we'll call on you in the order that you raise your hand. All right, Tom, you looks like you're first.
Hey, Dr. Buchanan. I think we tried to ask this last week about DHEC playing a more active role in getting folks vaccinated. I know you mentioned that it's available everywhere in the community in terms of flu vaccinations. I know you mentioned that the drugstore, CVS, and so forth are trying to help with the nursing homes. Is there any discussion about becoming more active and getting more folks vaccinated, doing more proactive things?
Those are really great questions for our COVID division. And my understanding, a couple things. One is that with the change in the commercialization of the vaccine, that has changed somewhat how public health is involved in getting folks vaccinated. Again, I'll have to circle back with our COVID office and make sure and understand better what they're doing to improve vaccination rates. But there are partnerships that have been created among long-term care facilities and the Walgreens and other pharmacies that are out there that are providing vaccine, so that those vaccines are available to those folks that live in long-term care or assisted livings. And so it is available through other means. So, in public health, we partner with the public health system, which is hospitals, doctors, pharmacies, and everyone else to accomplish the task that we need to accomplish.
Thank you.
Mm-hmm.
All right, and Jalen Tart.
Good morning. I wanted to know again, what was those numbers that you said at the top of the meeting with the hospitalizations and the flu deaths?
Sure, and those numbers are available on our flu respiratory illness, our Flu Watch page. So there are a little over 300 hospitalizations and about 11 flu deaths in the last week, although I believe 2 of those deaths occurred earlier in the season and were just reported to us in the last week.
And I will drop that, the most recent Flu Watch into the chat so people have access to that. Right there. All right. Anyone else? It looks like, Jalen, is your hand still raised or was that it?
That was all that I have.
Okay. And Vincent? Oh, sorry. His hand went up and then went down. Oh, he's in the chat. Let's see. Vincent asks, do you feel any frustration by low vaccination rates given the availability of vaccines?
In public health, we always want vaccination rates to be as high as possible. We'd like to see 100%. We know we'll never see that. So, we just really want to encourage everybody to get vaccinated. And we know it would make a difference in our hospitalization and disease rates. So we really just want to stay positive, encourage everybody to get vaccinated. And yes, we always want vaccination rates to be higher, not just for flu and COVID, but for vaccinations across the board.